On this episode of 26 Minutes with Dr. Warren Seigel, Dr. Seigel is joined by Dr. Maggie Tetrokalashvili, the chairwoman of the Department of Obstetrics and Gynecology at NYC Health and Hospitals South Brooklyn Health. Together, they engage in an insightful conversation about menstrual problems and menopause, shedding the light of physical and emotional challenges that many women face throughout different stages of life. This discussion aims to empower viewers with knowledge, compassion, and practical advice for managing these important aspects of women's health. Dr. Tetrokalashvili brings over 25 years of experience in women's health and a distinguished career marked by leadership, innovation, and education. Having trained and taught by the top medical institutions including NYU Medical School, Mount Sinai, and Case Western Reserve University, she continues to lead with passion for patient-centered care and clinical excellence. At South Brooklyn Health, she oversees a dynamic team dedicated to serving women from diverse backgrounds, advancing access to reproductive care, and promoting wellness throughout every stage of life. Let's take a look.
I am so thrilled that you were able to just do this. I know you got a very busy schedule, so thank you for being on the show today.
Thank you. Thank you for an invite. It's really an honor to be here and to represent the field of obstetrics and gynecology.
So I know you're an obstetrician, which means you deliver babies, right? I know you're a gynecologist, which means you're a specialist in women's health.
Right.
Today, I really want to learn something about menstruation. So could you explain what is menstruation? What are the myths? Why do women have periods? Tell us a little bit about that whole part of the world that so many of us, not just men, really don't understand.
Right. It's amazing, right? These are two big M's that we are going to speak about menstruation and menopause. Pretty much unavoidable in women's life, and there is still so much mystery around the topic. And recently it was more taboo than today, and it's amazing that today we're talking about it so openly and trying to educate even more our patients, our women.
It's interesting you say taboo.
Right.
People didn't talk about it, but I remember as a kid hearing people say it's the curse. And you're basically saying, no, this is normal part of women's health, right?
Right, yeah. I mean, again, this is something I think it's normal. Every woman experiences it. And we can go back to history in many, many centuries ago and see how attitudes change over time. You asked what is menstruation, right? Just that the term menstruation comes from the Greek and Latin words mene, which means moon or the month. And it's amazing that moon goes around the earth in 29 days, and average time for menstruation from day 1 to the last day of menstruation is 28 days. So it was thought that there is some kind of association with the cyclicity of the menstruation, even though research is different and they view it differently today. And there were different cultures viewed menstruation differently. You mentioned that in some cultures it was considered the weakness, something that the curse, right? So for example, men cannot touch anything that women touches at the time of the menstruation. In some cultures it was celebrated, and it was considered if the woman goes out during her period in the fields, then it will be a better year, better crops. And the young teenage girls, they were starting to menstruate. They were also specially celebrated in the communities. So views have changed over time, and whether it's a taboo or it's an open subject, it's also very different in different cultures and in different times.
That's fascinating.
Right.
You know, again, as a man, I've always been socialized to think about this as something that was really hard for women. They get a lot of cramps, and it's horrible, and you know, many patients complain about menstruation. Why do women have a period every month?
Right. So menstruation is there. It serves a purpose. Let's put it that way, right? It serves a purpose for women to become pregnant. So every month there is the the egg that's released from the ovary, and that egg makes the hormones that grows the lining in the uterus that's called the endometrium. And at the end of every month, that endometrium or lining in the uterus is ready for the pregnancy, is ready to accept the pregnancy. So if the pregnancy does not happen, then those hormones cannot be sustained forever. There is withdrawal of the hormones that is presented in the way what we call the shedding. So menstruation is really a shedding of the lining of the uterus, right, and some blood that comes out with it, because everything in our body is supported by blood vessels, by nutrition. So it's not just the tissue that comes out, but also the blood within the vessels that feed the tissue, and those vessels that cannot be sustained anymore because of the hormonal changes and withdrawal at the end of the period.
So there are times when women stop having their periods, right? Obviously when they're pregnant. Okay, everybody knows that. But are there times when women don't have that period every single, I was about to say every month, but you just taught me something. It has something to do with a 28, 29-day cycle. Is it always abnormal?
Is it always abnormal to have? So it is normal to have menstruation every month. Certainly it's not normal if the menstruation starts before certain age, right? When we talk about adolescent or pediatric population, we do see menstrual cycles sometime after age 8 and 9 when when girls start to menstruate.
So girls can have periods at 8 and 9, and that's still normal.
It's early, but it's still
normal.
It still happens, and it varies based on the ethnicity. Some ethnicities have earlier menstrual cycles, some later. And average age probably between somewhere 11 to 14-year-old. That's what we see. So it's not normal to see the period by the age of 16, or it's not normal to see the period when what we call secondary sexual characteristics, when breasts are developed, right? The hair, pubic hair is already developed, and there is the lag, 2-3 year lag after that, and
so
we don't see period if they don't have period after that. So that's considered abnormal.
So earlier than 8, 9? Check with your pediatrician.
Absolutely, check
later than 16?
Later again. We
check with your doctor as well.
Or the pediatrician as well, right? The 16-year-olds will still see the pediatricians, will still
So what
see
about if you don't have a period every month or every 28 days, every 29 days?
Certainly the upper limit of the period is around 40 days. So anything above 40 days is considered abnormal. Why? Because the hormone that's called estrogen, right? The eggs are making hormone estrogen, and that estrogen builds up the tissue in the uterus. And then there is after ovulation, if women what we call ovulating, which means releasing an egg, the second hormone, which is called the progesterone, is produced. That is going to support that lining, support endometrium to accept pregnancy. But if there is an estrogen produced, but there is no ovulation, so progesterone is not produced, then you're not going to see the shedding of that lining. So estrogen can keep growing the tissue, which is not healthy, because that tissue later can undergo what we call hyperplasia, overgrowth, and even put the woman at the risk of endometrial cancer if it's not opposed by the second hormone, which is progesterone. So every time we hear about the cycles that are above 40, right, 40 days, we start the workup, make sure that patients, the hormones are okay. For example, thyroid hormones, they can affect the number of the days of the menstrual period. Another hormone that's called prolactin, that's normally produced during pregnancy and should not be produced in the amount that is we see during pregnancy. Outside of the pregnancy, that can be elevated in some women, and those women can present also with a longer cycle.
So this seems really complicated, but see if I get this right. If you start having your periods too early, check with a primary care doctor. If you're not having your periods by 16, check with your primary care doctor. If your periods are happening, but it's too far apart, check with your doctor. What about if you're having periods very frequently? That must be horrible.
Yeah, so again, 21 days is considered within the norm still, but anything less than 21 days is bleeding too frequently. It means that, again, that lining cannot sustain itself, and it just, it just bleeds, it sheds irregularly. So that can lead to excessive blood loss, that can lead to anemia, and anemia can affect the heart and, cause other health problems in the body. So too frequent is also something that we should be concerned about.
What about pain? I hear for so many women that they get a lot of cramps and they get headaches and they just feel horrible when they're having their periods. Is that normal or is that abnormal?
Right, great question, right? Because we're used to thinking that pain is normal. Why? Because that tissue that sheds, anytime there is a destruction or shedding of the tissue, the substances that are called prostaglandins are released. The prostaglandins are the molecules or the substances that cause the pain. So you cannot shed tissue without having those prostaglandins around. So some degree of pain is normal. But when, for example, woman comes and says, I always had mild pain and I took ibuprofen and I was fine and a couple days and then I feel okay. But recently, suddenly my ibuprofen doesn't help anymore. Or my periods are getting more painful than they used to be. So when we look at the woman in this progression within the time and see, are the symptoms same or they're getting worse? Something that's getting worse, then it should put an alert that something is going on. And
so pain could be normal if you're having your periods and it's lasting the right amount for you, because every woman is different.
Is different.
But if the pain is getting worse and not responding to what you usually do.
Right.
Can you give us some examples? What do people do when they're having bad pain or not worsening pain, but when they're having their periods? Are there things that they can do to help them?
Absolutely. There are things like home remedies. They're also helpful, right? For example, heat packs. And they've been around for a long time, and women do use it, and certainly it causes the vasodilatation, right, and it helps with the pain. But also over-the-counter medications like Tylenol or ibuprofen, what we call NSAIDs, non-steroidal anti-inflammatory drugs.
Now, I was always told that Tylenol doesn't really work for cramps, but acetaminophen doesn't work for cramps, but ibuprofen works better. Is there any data to say one doesn't work and one does work?
There is no one-size-fits-all. So we've seen patients that NSAIDs work for some patients better, and some patients Tylenol actually.
NSAIDs meaning ibuprofen.
Ibuprofen works better for some Tylenol, for some combination of the medications.
So once again, every woman is different, women have to figure out what's normal for them.
Correct.
But when there's a concern, speak to your OBGYN, speak to your primary care physician.
Correct.
Makes a lot of sense.
Yeah, one little caveat that I always tell women, that once that pain cascade starts, right, that prostaglandin release initiated, it's harder to control pain. So if somebody notices that my period is 28 days, but on the 26th or 27th day, I start having those pains, and it happens from month to month, then we advise start NSAIDs a couple days before, even before you normally experience the pain, to prevent the pain rather than address pain when it's already there and it's more difficult to address.
And is there a particular time when women have more pain than others? So you mentioned 26, 27, 28 days when I'm about to have my period, right? So I'm not having my period, but I know that it's coming this weekend. Is it normal to have pain in the middle of the cycle, or is that abnormal?
Usually women experience more pain at the beginning. At the beginning when that shedding starts, because what happens, the muscle of the uterus contracts, right? It needs to bring the tissue out. And those contractions of the muscle that cause more pain. And as the time goes on, there is less, the bleeding subsides also. With less bleeding, there is less work of the muscle, less contractility. So pain usually subsides. But again, some people have more pain day 2 or day 3 at their heaviest days, rather than on the days when their bleeding is lighter.
So women can have too much
blood.
Or they could have not enough. They could have pain. They might not have pain. Everybody is different. What about women who, as they age, stop having their periods?
Right, so it's very interesting, right? Because that irregular cycles, or women saying my period is coming now less frequently than before, and we are getting into the age of menopause. We're approaching the menopause. Menopause is something that is not something that today, you know, I quit having periods and that's it. I'm in menopause. This
So
is a road.
It doesn't happen
It
on
doesn't
a particular
happen on a
date.
particular date. Maybe it happens on the particular day of the cycle, but there is a road, certainly road to that. And what the research shows that women start having those irregular periods a couple years before the last menstrual period. So menopause, the diagnosis is made retrospectively. So you have to have 12 months of having no period to say, yes, you know, I'm in menopause and everything is okay. There are no other hormones that are affecting. There is no other diseases that suddenly I stop the period, but it's a real menopause. It's a retrospective diagnosis.
Really, that's interesting. So a year before you have menopause, whenever your body says you're going to stop having periods, your body starts getting ready?
Getting ready. It gives
Isn't
you
that
signals.
fascinating?
It gives you
How
signals.
smart the body is, isn't it? Really, that's
amazing.
fascinating.
It is.
So women start having more irregular periods as they get closer to menopause.
Yes.
So it isn't necessarily abnormal. They might be ready. Is there an age when women in this country have menopause?
Right. So the average age of menopause is 51. But those changes, they can start as early as 40-year-old. Right? So after age 40, it's considered to be normal if you have menopause after age 40. Something before 40, we worry more. We say
after age 40.
After age
That's
40.
interesting.
After age
So
40.
often I think of menopause as women who are older, not old. I'm not saying everybody's old, but 40. That seems really young to start this process, isn't it?
It does. And those changes that I mentioned in the irregularity or less cycles, the average age when they start is around age 46, 47. So average age of menopause is 51, but changes already start around, let's say, 46, 47 for someone who is going to go to menopause at age 51. So what we tell women that there is no specific test, even though there are certain tests, let's say for anti-Mullerian hormone. This is the hormone that is also produced by ovaries. And when it's low, it gives you some idea of the reserve, of ovarian reserve that's left. But it's not a very, very specific test. You can monitor it over the time. But the cycle itself gives us some hints. So when you start missing cycles, let's say you would have them every 2 to 3 months instead of every month, or when you get to the later stage of premenopause when you don't see cycles, let's say for 6 months, and then they might come back and they disappear. So at that point we can say that it's most likely that within the next 4 years you're going to go through the actual menopause.
Very interesting. But I'm assuming that for that period of time, whether that's 2 years, 3 years, 4 years, that your body is going into menopause, you could still get pregnant, right?
Absolutely.
Oh, so that's where the whoops comes in, right?
And one more surprise. Good that you asked that. It's very surprising, but women who are approaching that right before the menopause, some women actually ovulate those last months before menopause.
Wow.
So that's how
like the last hurrah.
It's
the
like
last
chance, right?
The last chance.
Last
Fascinating.
ovulation.
Fascinating.
Is fascinating.
So let's talk about menopause. Besides the periods that women stop having, which again, as a man, I think would be great. No muss, no fuss, no pain, no headaches. Are there other things that women need to know about their bodies once they go into menopause?
Yes. So menopause itself maybe does not cause that many changes in health, but what luggage we bring to menopause, everything gets accelerated. For example, if we're talking about metabolic syndrome, right? The metabolic or weight changes. Weight change does not start right after menopause, it starts before menopause. But in those early menopausal years, that's when we see the most acceleration of the weight. Weight might continue growing even in late menopausal years, after or post-menopause, but not at that speed as it's happening around that perimenopause.
So metabolic syndrome meaning I gain weight very, very quickly?
Gaining weight, high blood pressure, cardiovascular disease, type 2 diabetes. Right? So menopause does not cause diabetes, does not cause cardiovascular disease, but you can imagine that estrogen is like a protective layer from all those diseases that we're developing, but now that protective layer, the protection, the guard is not there anymore. So everything becomes more accelerated and more pronounced. It's bad, but it's also good, because if we know it, this is the point when we need to address all those healthcare issues. This is the point when we need to follow the lipid profile, follow the weight, right, and have lifestyle changes, exercise, the diet, changes in the diet. We can counsel women about smoke cessation and alcohol and obesity, everything that's modifiable. So it gives us a chance to open the conversation that this is the age you might start, right, unveiling all those symptoms and diseases, and this is the time when we need to be aggressive to introduce those modifiable changes.
So rather than seeing this as a time where I don't have to see my OBGYN,
right, it's opposite.
This is a time where I have to see him or her more often.
And not just OBGYN.
And not just OBGYN.
Minimum 4 specialists, right?
So yes.
That will be OBGYN, there will be a primary care. The mental health, we're not talking, right? So some people have maybe anxiety or depression, and around the menopause, again, when estrogen is not there, that's where depression and anxiety sometimes gets worse. So behavioral health, mental health is important. Bone health, right? It's once estrogen not there, we start losing the bone. We lose bone slowly after age 35, but around perimenopause, that's when that bone loss is also accelerated. It's not just the how thick the bones are, but also how strong they're becoming, more fragile. So again, this is opportunity to give patients the calcium, vitamin D supplementation, again, exercise, weight-bearing, aerobic exercise, and open those conversations to prevent future osteoporosis, prevent future fractures. This is also the time when the cancer, oncologic diseases, right, start to show up, whether it's a breast cancer or the colon cancer, lung cancer, which is the #1 killer today. Again, to have all those screening tests and see the primary care physician together with OBGYN, who is also primary care, and work collaboratively. This is an amazing opportunity that needs to happen around the perimenopause.
Oh, this is so helpful. But I know we're running out of time, but I can't possibly talk to a gynecologist without talking about uterine cancer and pap smears and the importance of pap smears. Sure. When do women start having a pap smear? Is it really important every year? And when do you stop? Do you stop at menopause?
Yeah, so the age that we recommend starting pap smear is age 21, and recommend stopping pap smears at age 65. But having in mind that that woman did not have any precancerous, any abnormal pap smears before, and she had at least 3 normal pap smears before we say you can safely stop doing the pap smears. The guidelines, they do change because there is more and more research coming up about the HPV. And HPV today, it's responsible for 99% of the cervical cancer.
HPV, this human papillomavirus.
Human papillomavirus.
And now we have
right.
a vaccine against that, right?
And we have a vaccine, which is great.
We
a
start
great opportunity.
In the pediatric years.
Pediatric years.
And can women get the HPV vaccine?
Yes. Yes, absolutely.
So adult women can get it.
Adult women can have up to a certain age, because after, let's say, age 26, they can still get it. But the HPV types that the vaccine covers, they probably have been already introduced if they've been sexually active before that. So it's still protective, but maybe not 100% protective after a certain age. And what you asked about screening, how often, right? So from age 21 to age 30, it's recommended that we do pap smears every 3 years. After age 30, there are options. So we can do, for example, just pap smear every 3 years, or we can do just HPV every 5 years, or pap smear and HPV combined also every 5 years. That does not mean that women should not come for OBGYN visit yearly, right? This is very important, that women sometimes come just for the pap smear, but it's so much more than the pap smear, the women's health. So even though pap smear may be every 5 years or HPV every 5 years, women still needs to come yearly to make sure that the uterus is okay, that the ovaries are okay, that we're not missing anything else, right?
That's interesting, because I've always heard that's the reason why women don't want to go to their OBGYN, because they don't want the pap smear. So this is wonderful information. Prevention, prevention, and prevention of everything can be done by your primary care doctor, by your OBGYN, and once again, if there's a question, ask.
Absolutely.
Ask.
Absolutely. We are
Thank
here.
you so much. Wonderful information.
Thank you very much. Thank you again. Appreciate it.
Hey family, that brings us to the end of our program. Thank you for tuning in and learning alongside on the Zermatt Show. This program was brought to you by Brick Media in partnership with NYC Health and Hospitals, South Brooklyn Health. Until next time, stay well, stay safe, and thank you for watching.